they don't qualify for Medicaid. They can't afford for him to go into a nursing home and for her to maintain her apartment. Their income simply does not allow that. So what I'm saying to you guys is, and what Lee's talking about, spending down, it would be in your best interest to know what your gross income together is as a couple. And know what the Medicaid guideline is. As a couple, you can only make so much. If you make over that, then you are not Medicaid eligible. Do a little bit of research or call one of us and get some information. Have an idea how much it would cost to go to a nursing home or to live in an assisted living facility. And I'm saying that because you never know when there's going to be a medical emergency. Is it going to be tomorrow? Is it going to be next week? Is it going to be 2 years from now? But you need to have some kind of plan in place. You need to know where you are financially. What are you going to do if something happens? Are you going to be able to manage? Do you have a support system in place? Do you have children that live nearby? There's just a lot to consider, guys. And, we have spent days sitting down going over options. Is Medicaid an option? Is private pay an option? Is it an option for both of them to go into an assisted living, give up the apartment? Would that work for them? Private caregivers, basically out of the question, because if you look at the cost of a in-home private caregiver 24 hours a day, it's astronomical. You got to have some bucks to be able to do that. You wouldn't be looking at Medicaid if you could afford that kind of care. If you can do that, that's certainly the way to go. But so many people can't do that. So I'm just saying it really is a good idea. Not only should you have a power of attorney in place so somebody can make those decisions if you can't, but know what the options are, because there are lots of things to look at. Most people don't understand that there are different levels of care. There's the nursing home, there's the assisted living, there's the small home assisted livings that are licensed, and then there are the little bitty ones that aren't licensed at all. There are lots of levels. Where can home health go? Well, do you know that? Do you know where it's appropriate to have home health and when it's appropriate to have home health? Those are pieces of information that it would really behoove you all to have. Do you really know what hospice covers? Do you know that hospice isn't when you're on your deathbed necessarily? We have patients that are eligible for hospice that are appropriate hospice patients that have been on our service 3 years or longer. It's not the last 2 weeks of life. And hospice takes care of a lot of things, like all of your durable medical equipment. Hospice works with home health. Sometimes we have patients that have both home health and hospice care. Many of our patients do go to nursing homes, and we work very closely with them, as well as the assisted livings. So there's a lot of information, guys, and it would be in your best interest to kind of have a plan in place. Know where you are financially. Know who your support system, where it is, and is it in place. Make sure that your friends or your relatives have a copy of your directive, your advance directive, and who your POA is. Because if something were to happen to you or to you and your spouse, who's going to know that? You show up at a hospital or an emergency room and y'all can't talk or you can't make a decision. If you don't have these things in place, and it's like Lee said, oftentimes one part of the couple can't get to the assets because of the way they've got it set up. You don't think that's gonna happen, but it happens. And then you've got a hospital scrambling, you've got nursing home folks scrambling, you've got hospice people scrambling, trying to put the pieces together and do the best we can do. And it's so emotionally draining for the family when that goes on. Just like this little couple we were helping, all of their information was in storage somewhere, and the little wife didn't have a clue how to get to it. It has taken days to put this all together. Lots of phone calls to insurance companies and different places because they didn't have their act together. And then tragedy hits, and they're dealing with the physical part of it on an emotional level and a physical level, and it's hard. It's really hard. So I'm just saying it's much easier if you do stuff now while you can, before there's the emotional burden that comes with it.
I'm gonna add to that and spring and actually modify a little bit. That's absolutely correct. Get your documents, like I said earlier. Make sure that your documents are done so that those who are going to take care of you can. Exactly right. We can all tell stories. Just here at UMC, I had a client passed away last night, or night before last. His name was on the bank account and hers wasn't. So for the entire time, the several months that he was ill, she had no way of accessing the account to pay bills. There was no information. He has no will. He had no will when he passed away. The two children he hasn't seen in 30 years now own half of his house. So make sure that you have got those things in place. So all of us have terrible stories. Now we'll modify Rose a bit. For nursing home care, there is effectively no income limit for Medicaid. Let that sink in. There is no income limit for Medicaid, except effectively if you make $45,000 or $5,000 a month income, you can pay for your own care. There's a magical thing called a qualified income trust. If you have too much income as an individual, you can get this trust put in place. It's weird. It's a stupid government creation to solve a problem they created in the first place. But effectively, if you meet the other requirements for Medicaid, there is no income limit for an individual for Medicaid in the nursing home. Now, assisted living doesn't really apply. There's not much assisted living available through Medicaid for most elders. There's some for disabilities, just not very much. In the Dallas-Fort Worth area, there's quite a few places that take assisted living places that take Medicaid as long as you meet the requirements. But the qualified income trust effectively turns income into not income. You still have the same money coming into the household, still on its way to the nursing home. It just is not called income anymore. Married couples, it's a little bit more different, but the individual ultimately is limited to the same amount of income. But depending on the couple's income, some of the sick spouse's income can go to the community spouse. The upshot is understand that income is probably not going to prevent you from getting Medicaid. It's resources, and not knowing what resources count, and not knowing the effect of those resources. Let me say this about couples, since we're going to leave aside income, because that's not an issue usually. For married couples, we can almost always get the first of the couples qualified, at least theoretically. Now, you may not want to do what's required to make that happen. You may have to sell the family farm to buy an annuity to make it work, but very important to understand, almost always, the first one can get qualified. The second one, not so much, depending on what the couple has. But the first one who can almost always qualify, and that's by design. It's designed to keep the community spouse from being completely impoverished by taking care of a sick spouse. And it can be fairly generous. It is possible. So just bear that in mind. The rules themselves are complex enough we can't sit down here and I can't draw on the board and go through all the details. But important to understand, income's not going to keep you from getting nursing care. And for the couples, we almost always qualify the first one, really independent of assets. And if you're so wealthy that we can't make that work, then you don't really need Medicaid in the first place. But just understand those things. Someone started to raise their hand. You had a question, ma'am.
Yes, when you talked about Medicaid qualifications, your homestead is exempt, right, for on Medicaid if you have your home? That's
Tell you what, let
exempt.
me give you a quick little rundown of rules.
Okay.
Because So many people know so little. Please educate yourself. Come see somebody, and don't take the word of a friend unless they happen to be a Medicaid worker or an attorney. Like me, working in the field, most attorneys have no clue. Like I said, the nursing homes have a very extremely detailed knowledge of certain areas of Medicaid, but not others. I really encourage you to talk to an attorney. There's at least 2 here in town that are quite knowledgeable. I will admit to being one half of those, but there is another attorney. I'm not going to tell you, come see me. I'm saying go see an attorney who knows what the flip they're talking about. And don't assume that if you go on the internet that you're going to get the best answer there either. So general rules for an individual, you have to first have medical necessity. Now, you can be invalid, absolutely out of your mind invalid, and not have medical necessity. Medical necessity, very specifically, is you require the attention of a licensed medical professional on a continuous or ongoing basis. Now, understand, you can be absolutely confined to bed, and you can be largely out of your mind. But if all of your assistance, if all that is required is just physical help, you will not qualify for Medicaid. I know one case of a 100-year-old lady who had 2 failed hip operations, so she had legs that were attached by her skin. She took aspirin, her mind was as clear as a bell. She did not qualify for Medicaid, even though she was absolutely confined to that bed. So understand, medical necessity is very, very specific. It's modified slightly for the community programs, which I'm not talking about here. The general rules are the same financially, but the community programs are harder to get. They're just not available. There's a 2 or 3 year waiting list. I don't even talk about it. Usually if you're sick enough to qualify for that, by the time it comes available, you can't qualify for it anyway. For a married couple, very important, there's a magic number called the minimum monthly maintenance allowance, $2980.5 per month, $2,980 per month, gross. Remember, add back your Medicare B premium. Add back anything else that's deducted from your income. $2980 gross. If your unassignable income, basically your Social Security or pension, if your combined unassignable income is below that number, you can almost always qualify with no spend down.
Is that per person?
Combined couples gross income, $2980 of unassignable, not investment income. I'm not talking about required minimum distributions. I'm not talking about farm payments. Those are all treated as an investment. That might affect what your copay is to the nursing home, because there may be a copay. But in terms of eligibility, all they're looking at is income you can't get rid of. You can't get rid of your Social Security. You can't get rid of pensions. You can't get rid of irrevocable annuities. So if your combined income gross is less than $2980.5 per month, you can often qualify without any spend down, which means you are financially eligible the moment you walk in the nursing home room. Okay? If it's more than that, you may have to do a spend down. Now, the spend down is complicated enough that I'm not going to get into much of the details, but you can still keep significant resources, and to the extent that you're over-resourced, the community spouse can always buy an annuity, which converts resources into income, because the community spouse's income doesn't matter. If your combined income is more than $2980 per month, then their income doesn't matter anyway. And then so you can qualify by converting resources into income. So it's complicated. I know that's going to be more complicated than some of you can deal with just at the moment. What I want you to understand is it can be done, especially for that first spouse. The thing that I find people cannot recover from is making gifts without knowledge of what they're doing. You hear all the time, well, you need to get the house in your name. No. Okay? No. Come talk to me. That's probably not an answer that you're going to want. You need to give all that money away. They only look back 3 years. No, they look back 5 years. And there's no countdown before. It's the full amount for the full 5 years. Medicaid says not to gift, or does not say not to gift. They say if you gift, there's a penalty. If you can deal with the penalty, make the gift. It may be the best. It may be the least expensive option. But please do not start gifting without knowing what you're doing, because once you give that money away, if that child spends it, you can't get it back. And the penalty can be severe. And Medicaid's not terribly concerned about your other debts. In fact, they're not concerned at all about your other debts. So there's lots of issues to deal with, and someone said, if you're old enough, you need to have those documents in place. You need to know about Medicaid. You know what? I have people who are 70 years old taking care of parents. They need to know about Medicaid as well. We have folks who are doing retirement planning with, financial planners and advisors have no flipping clue about Medicaid, yet they purport to be advising this person who happens to have 2 living parents, one of whom, has diabetes. Guess what? You may be taking care of that parent. Is that part of your retirement plan? So it's important that even if you are not the one who might need it, you may be taking care of parents. And as our population ages, that gets to be more and more common. I have had a lady who called, she was 85 years old and taking care of mom who was 107. Both of them were at home. So it's not unusual to have folks who are having physical struggles of their own who are still taking care of a parent. So get those documents squared away and learn a little something about Medicaid, and don't do anything until you talk to an attorney about it.
Awesome. Thanks, guys. You got a question here?
Is there a handout that has, my contact information should be on some handouts they brought, because I didn't bring cards because I wasn't sure, and it's an educational thing. I'm not up here banging away trying to get work. Certainly I appreciate it, but I want you guys to know, because if nothing else, I can save some of you some pain and agony just by saying, go look.
Can come back and recover?
Oh,
okay,
yeah.
Can you explain that to me?
Yes, the Medicaid Estate Recovery Program. I knew somebody, I should have just said something, huh? If any of you guys want to talk, I'll yield the floor. I'm okay. Medicaid Estate Recovery Program. Medicaid retains the right to recover from the estate of a single person, whatever they spent on the person. And so as soon as you go on Medicaid, they keep a list. They run an invoice, okay? And even if you're married, they run an invoice, because you might not be married by the time you pass away. So if a person who is single dies, who has been on Medicaid on one of the waiver programs, and waiver is a magic word that means MERP applies, they can recover from the probate estate. You've heard it said, well, won't they take your house? No. They can't take your house. You have no claim against your house. The claim is against your estate. So if you're single and you're on Medicaid, what do you have? A house, maybe a car, up to $2,000 in the bank account. So if there's a recovery, what's going to have to happen? Your personal representative, your executive, is going to have to sell the house to pay the bill. Well, if the house is worth 40 and the bill's worth 80, no one's going to sell the stupid house. No one's going to do anything with it, and they're not going to recover anyway. It's one of the most poorly designed laws you can possibly imagine, and for a reason. The federal government says you must have, in order to receive this money, you must have a recovery program. Texas said, fine, we'll do a recovery program and we'll make it ineffective. So there you go. So the thing is to avoid the probate estate. So because that's what they recover from. If there's no probate, what is probate? Does anybody know what probate is? It's to prove the will. The probate process is to prove that the will is valid. If you stick a will in my face and I have money of yours, or money of your decedent, and you stick a will in my face and say, this will right here says that money is now mine, I see a piece of paper with some pretty squiggles on it, because unless there's a judge's order attached to it that says this will is valid, it doesn't mean anything. So please understand that. That's what the probate process means, to prove who owns this property that the decedent died with. Well, if the decedent's given it all away, there is no property, there's no reason to probate. If the property automatically transfers without the probate process, there's nothing in probate. CDs have pay on death beneficiary designations. IRAs have beneficiary designations. Investment accounts have transfer on death designations. All those things are not in the probate estate. They're irrelevant to Medicaid because they don't have those things if they're on Medicaid. But if the house passes automatically, then there is no need to probate. And Medicaid allows people with the right document, with the right intent, they allow the house to transfer to the family. And it only makes sense. It's good policy. Unfortunately, our day and age, not everybody takes care of mom and dad. Not everybody recognizes that obligation unless there's something in it for them. So the state recognizes the reality that that lots of times the family has kept the person out of a nursing home longer, and if there's something that they can recover back from that, because in most cases people spent far more time, effort, and energy than they'll ever get from that house. Medicaid does allow it to pass. They use what's called an enhanced life estate deed. Some people refer to it as a ladybird deed, perfectly acceptable to Medicaid. The house passes automatically without generating any kind of penalty. See an attorney. There's a handful of attorneys in town who can do those, don't know anything else about Medicaid.
Thanks, Lee. I think we had a question over here.
What about a prepaid funeral expense? Does that count
As
against your
long as it's
Medicaid?
irrevocable. She asked about prepaid funeral. If you have purchased your funeral, remember I said before, if it's not money that's available to you, then it's probably not going to be countable. An irrevocable prepaid contract, you can't get the money out of that anymore. It's gone. It's an exempt asset, basically. So that's perfectly fine. In fact, it's highly desirable if you're having to do a spend down, then that's even most nursing homes know that. Prepay your funeral. Pay for your taxes for your houses, prepay your insurance. Doesn't take care of the mortgage payment on a house. That's a whole different problem. Doesn't take care of the taxes and insurance over the longer term, because guess what? If you're on Medicaid, you get $60, period. Remember I said Medicaid doesn't care about your debts. They don't care about your taxes. They don't care about your insurance. They don't care about any of that. Not because they're mean, it's just the way the rules are. And so $60 doesn't cover very much property tax. So you're going to have to concern yourself with how to keep that house going. Sometimes there's someone living there, a family member, that's great. Sometimes it just sits empty, and it's not desirable always. See an attorney who knows something about those.
So Lee, when they purchase a prepaid funeral arrangement, they need to make sure that they ask, is this a irrevocable or irrevocable, correct?
That's correct. Used to, you had to get a letter that said this is irrevocable. It was real common to have to seek something from the nursing home or from the funeral home that said it was irrevocable. Typically now, the typical contract, guess what? As slow as they are, the funeral homes have begun to learn a little bit, and the contracts often say this contract is irrevocable for 3 days. Well, the implication is after 3 days you can't revoke it, and so that's usually perfectly acceptable to Medicaid.
All right, looks like we got about 5 more minutes left. Is there any more questions? Anybody else got anything?
I do, again. So what, in a capsule, I don't know who could answer this, what are the major changes we're looking for Medicare this year? I keep hearing that premiums are going up, or who does that affect?
I just want to say one thing, and then I'll let everybody answer, is with the Medicare and the Medicare replacements, be very cautious of trading over to a Medicare replacement. Keep your regular Medicare. That's my comment.
That's an opinion. Medicare Advantage plans are very, very popular in other states, but not in Texas so much.
So Debbie, you're talking about the things like Amerigroup, Superior,
Amerigroup and Superior, if you're on Medicaid, they're going to choose one of those for you if you don't choose one yourself. I'm referring to Medicare Part A and B and those replacements, yes.
Okay.
Here in Texas, because of the benefits that you will receive, may be less than what you can get if you stick to your Medicare. No, not supplements, replacements.
because some people don't even take some of these at all.
Correct. And so that is one of the main things that has been trickling for the last few years that I've seen has really caused some elderly patients some really hard times, is thinking one of these policies was going to be very beneficial and in turn has not paid for what they needed.
Or not paid at all.
Not paid at all.
Joan, to answer your question, in our realm, Medicare Home Health 3 years ago, we did 20 visits on average in a 60-day window of time. Today as an industry, we do 14. Medicare pays us 30% less today than they paid us 5 years ago. So for you as a client, for any agency in town, you get less services in that 60-day window of time. Medicare Home Health operates in 60-day increments. We have to get your physician to certify. We're going to offer these lists of services. He signs off on it. You've signed off on it. So we're going to offer these services under that 60-day window. So for many of you that get home health today that maybe had a knee replacement 2 years ago, you had a therapist, probably an occupational therapist and physical therapist that came out. You had a nurse that came out. We may have done 20 to 25 visits, in a 2 to 3 week window of time. You went to outpatient therapy after that. Today, Medicare home health, you have a knee done, you're probably going to get 10 to 12 home health visits. You're going to go see your physician on day 14 for your follow-up appointment, and then you're going to outpatient for a certain regimen if you can get to outpatient. That's not everybody only gets that's just the average that we see today. Luckily, or I mean, not luckily, but Lubbock County, Crosby County, and Lynn County were chosen 30 days ago as the acronym is CCJR, but if you have a knee or a hip surgery starting January the 1st, you're included in a bundle payment through Medicare. So the hospital gets to tell all of the providers in our post-acute world how many visits that we can give you, how many services that we can give you. It's Medicare's desire by 2018 to bundle every single disease process that we face: COPD, CHF, pneumonia, heart failure, diabetes. The hospital is going to dictate to all of the post-acute providers what we can do and how much we can spend. Lubbock County is one of the highest volume counties for a lot of the post-acute services that we offer, and we're also a high expense. So Medicare's come in and said, okay, you cost us a lot of money. We're going to tell you how much you need to save, and then if you don't save that, we're going to penalize you for not saving it. If you do save it, we're going to split the cost with you. So that the hospital gets half the money, Medicare gets half the money. They're projecting to save over $200 million just in this region alone in the next 5 years. So I guess my reason for the spiel is, if you had home health, if you had hospice, if you had skilled nursing prior to 2016, January 1, 2016, you're probably going to see something different. And you need to ask the questions up front. We try to educate people as much as we can, but if you're sitting in your hospital bed on day 3, you're thinking,